I got my friend Corey, and she's a physical therapist assistant, or a PTA for short. She is going to talk to me about a few chronic injuries that you might encounter, while you're working out. So one would be shin splints, impingement syndrome in your shoulders, lower back pain, aka sciatic nerve issues, and then elbow tendonitis. All right, Corey, so which one do you want to start with?
We'll start with shin splints. So shin splints mainly occur because of some sort of sudden increase in activity.
Like if you start doing a lot of cardio?
Yeah, like a lot of times people start running whenever they haven't really run before in their lives. So they go from not really running to running anywhere from a mile to 2 miles initially. And that can cause some strain on the muscle and the bone. So what happens is that there starts to become little micro tears in the anterior tibialis muscle. So
yeah, that's right there, right?
Yeah, it brings your foot up, and it's a muscle that runs along the tibia. And what happens is that muscle gets inflamed, and it kind of starts causing micro tears and pulling away from the bone.
Yeah.
That's why they're called shin splints, because it's almost like you're splinting that muscle. So
interesting.
It's kind of tearing. So
crazy, I didn't know that.
Yeah, so one of the ways to prevent that, and really with any of the inflammations or any of the diagnoses we're going to talk about, is stretching for all of them. So stretching before and after any type of workout, whether you're doing cardio-based workouts or not, because even when you're doing squats, just your toes kind of come up a little bit.
Right,
for your
that's going to
form.
strain that muscle.
Yeah, so even any type of lower body exercises will prevent those from happening.
Yeah.
Also, any type of non-steroidal anti-inflammatory drugs, or NSAIDs. So
like
if you
Advil.
like Advil, ibuprofen, things like that, and just the daily recommended dose. Anywhere typically from 4 weeks. You shouldn't probably prolong use after that.
Yeah. But if you start getting shin splints, taking something like Advil a few times a day will help.
Yeah, it'll help.
Cool.
And then
That's good to know.
obviously just rest too. Don't overexert the muscle, allow it to recover and heal. Water, muscles need hydration just like everything else. And then things like foam rolling can be beneficial, and obviously strengthening. So one of the reasons why I got injured was because it was weak to begin with. So strengthening to the ankles, hips, and core. So anything that happens in the legs will typically always stem from the hips. So there's some instability going on at the hips and some weakness going on at the hips to make you have some sort of abnormal running pattern, which could cause the shin splints. So strengthening of your hip stabilizers, strengthening at the ankles, and obviously proper support of your shoes. So making sure you have good arch support. If you're running, actually invest in good running shoes.
Yeah.
If that's going to start to become your hobby, you need to make the investment and get shoes that are meant to do an activity like that.
Okay, so what then? So let's say somebody already has shin splints. How can they get rid of them beyond like NSAIDs? Like you mentioned stretches and strengthening. So what are some what's some basic stretches and some basic movements for that?
Basic stretches, so you always want to do the opposite of what the muscle action is. So the action of the anterior tibialis, the muscle that's inflamed, is what's called dorsiflexion, or bringing your toes up. So you want to stretch in what's called plantar flexion, or bringing your toes down.
Okay.
Yep. So then you can just even put your toes down and kind of lean into the stretch and allow it to stretch. You can even do a quad stretch and couple it with a toe pointed stretch. You can use bands to help with your stretching and strengthening too. And then even just massage and going against the grain of the muscle. So your muscle runs down, so massaging upwards can help with that.
Interesting. Okay, so what about strengthening it? What kind of stuff would you do for that?
Strengthening, you can do what's called 4 ways. So you can strengthen the ankle going up and down, side to side.
So you just no resistance?
You can start off with no resistance, and then you can progress to resistance. So even me doing this right here, I have resistance just from gravity.
Right.
So you can think about it like that. And then once you start getting stronger, you can strengthen with bands and get, a TheraBand or some sort of resistance band and have the opposite pull and strengthen that.
So you're pulling, if there's a band hooked to like the floor, you're pulling away from the floor then, right? So you want to pull to your knee and strengthen that. Okay, cool.
Yeah, so you want to go into that dorsiflexion and strengthen. And obviously, the big thing with strengthening any muscles is your eccentric control. So you have a nice, quick concentric control coming up,
and then a nice
slow going down.
Cool, awesome. I had a trainer one time because I had really bad shin splints. He told me to stretch my soleus, so like, right there, kind of like lower part of my calf. What do you think about that? Does that help or not?
I think it's all, it's all interconnected in a sense, so I don't see why that would hurt. But I think at the end of the day, stretching the affected tissue is going to be the most beneficial.
Right, so it's not going to hurt, but
I don't think
dorsiflexion will help more.
Right.
And then strengthening it. Okay, awesome. That was informative. So what about tendonitis? What causes that, and then how can you fix that?
So tendonitis, so anything with itis is inflammation. So it's inflammation of the tendons. So with elbow tendonitis, they have kind of nicknames for it. You can have golfers or tennis elbow.
I've heard of tennis elbow. What's golfers?
So golfers is going to be with your wrist extensors.
Okay.
If you think about how you like swing a golf club and they're coming back and the wrist kind of bends back. So it's on the lateral side of your arm, and so it's going to be these muscles right here.
Yeah.
Versus elbow tendonitis is right here.
Inside.
It's on the inside, the medial side of your arm. Cool. So those tissues can get inflamed. Again, it's from them being weak at some point. So you've implemented some sort of strengthening exercise that your body hasn't really quite adjusted to yet.
So you basically kind of overused it too quickly.
Yeah, it's anything with tendonitis is a repetitive overuse injury. That's the baseline diagnosis of tendonitis. Whether
maybe it's gripping, like if you don't lift weights and you go start doing a bunch of curls, stuff like that would cause it.
Yeah, absolutely. Cool. So just your grip strength in general being weak, and then adding resistive training and weight training.
Okay.
But it's always due to repetitive overuse. And again, just like the shin splints, it got injured because it was weak.
Right.
So you're going to want to strengthen all the affected musculature. However, with any tendonitis, you have to let it be pain-free and that inflammation go away before you want to start strengthening.
So then the rule with tendonitis then is you need to rest, like take a couple weeks off until you don't have any pain, then start strengthening it. So I have two questions then for you. The first one, are NSAIDs good for tendonitis?
Absolutely.
Okay, cool. So, take some Advil to kind of help get that inflammation out of there. Because like you said, it's inflammation of your joint, right? So then what exercises, just give me like 2 to 3 exercises that are helpful once you're going back in the gym and you're trying to rebuild that.
So if you're referring to the lateral side of your arm, and we're going back to the eccentric control, because if you think about it with tendonitis, it happened because you're shortening the muscle tissue. So concentric contractions is when the muscle contracts. So like the bicep is the easy one to refer to. So this is concentric of the bicep, and then lowering is eccentric, right? So whenever you injure a structure due to tendonitis, and that's what we've come up with the diagnosis as, it got injured because of too many concentric repetitions. So you want to strengthen eccentrically. So that's the really important thing when you're going back to tendonitis and you're trying to repair and strengthen after that. It's always eccentric. So with your lateral tendonitis, if you come up into a really quick wrist extension, and then you go down nice and slow, and so we're strengthening these tissues eccentrically.
Awesome.
And then back up here, and you can even passively take it all the way up, so that way you don't even have that concentric contraction.
Yeah.
So you're doing that movement, but then you're strengthening eccentrically. And then the opposite with this, you bring your wrist up if it's the medial structures that are affected, and then you're passively extending down.
Awesome. Give me 1 second. Right there for a second, because my dog is a crackhead. So what are some good stretches now for tendonitis? Because now we've moved on to strengthening it. So now obviously we want to stretch it, I guess keep that inflammation from building back
Right.
up.
Really just stretching, just your basic wrist flexion stretch and then wrist extensor stretch.
So like right there
Yeah,
and
right
right there.
here and right here. Yeah, and I don't even have tendonitis and I definitely feel it. So,
Yeah.
and then even changing your hand placement, kind of going like that. Just really wherever you feel the stretch to allow it to kind of elongate that tissue. Ice is good
Yeah.
with the inflammation phase. If you're still kind of working on that and stretching, strengthening. Really, all of these are all preventable just by strengthening the affected tissues and stretching.
So this is kind of a rabbit hole, but it's related because it has to do with stretching. But in college they told me not to really stretch pre-workout, but to like actively warm up, but not stretch a whole lot because it makes you prone to tearing injuries. Now, obviously, stretch when you're done. But what's your professional take on that?
I've never learned that or seen that research anywhere. I've always known, so for my warm up before I work out, it's always like incline treadmill walking for 10 minutes. But I
Right.
still definitely stretch.
So an active warm up.
Right, I always do an active warm up, but I still stretch too. So.
Well, they were talking more like, go do like some high knees, go do some butt kicks,
Right.
get your heart rate going before you do any kind of stretching so you don't tear something.
Yeah, no, I think that's valid. So before you start stretching, you definitely need to warm up your tissues. So, like for example, I work out in the morning, so I'm at the
Yeah,
gym
you
at
definitely
5
need to
o'clock in the
warm up.
morning.
Yeah.
Yeah, so before I start doing a quad stretch or a shoulder stretch, I need to get my tissues just warmed up in general.
Right. You're
But
definitely
I
into
don't.
something.
I think the combination of an active warm up and stretching is completely fine.
Yeah. Okay, so let's go ahead and go on to lower back pain. What's your take on that? So, especially sciatic nerve pain, because a lot of people have that, and even if they don't have sciatic nerve pain, because that's on the right side, they still have something going on that's similar on their left side. How can you, because sciatic stuff is congenital, right?
Yeah, it can be.
Well, how can you kind of prevent those flare-ups, and then once you have them, what can you do to kind of get rid of them?
Yeah, I think the big thing with sciatic nerve pain from what I've learned in the research I've done is it all depends a lot on how that sciatic nerve runs. So with your piriformis, the muscle that it can either run through or run under that muscle.
Okay, so on me, where's the piriformis?
Piriformis is on your glute and it's about right here.
Right, so it's kind of like going from the outside of your hip to the inside of your glute.
Yeah, it kind of runs at a diagonal there. And depending on how that nerve runs, I think is how severe the pain will or won't be.
So then, if your piriformis runs like that, right, then your sciatic nerve kind of comes like that.
It can either run under it or pierce through it.
Okay, so then basically when you get a sciatic nerve problem, then it's that piriformis kind of getting inflamed and aggravating that nerve.
Well, you have to think, so your sciatic nerve is the biggest nerve in your body. It's about the size of my pinky. So roughly the size of my pinky.
That's huge.
Yeah, I've seen it on a cadaver. It's wild. It's big. And so it's a big nerve, so it has a lot of room and circumference to get aggravated and inflamed.
Yeah, that isn't, I had no idea it was that big. That's insane.
It's big. And then in turn, it affects the piriformis muscle. So the piriformis becomes inflamed, and the fascia, that protective layer around the muscle, gets inflamed and tight. And it can cause pain radiating all the way down from the knee to the ankle, everywhere. The biggest thing with piriformis pain or sciatica is stretching. So doing a piriformis stretch.
And then how would you stretch that?
So can you lay down?
Yeah.
So you can lay down
On your stomach?
on your back.
Okay, I'll just lay down right here.
Then you can do what's called a figure 4 stretch.
Yeah.
So since you're laying down like this, that's fine. And then this is gonna come up here, and you're gonna push at the ankle. You can bring that leg up. Is that comfortable?
So like that?
Yeah, you can relax this leg
Oh,
since
okay.
there's no mat or anything, and then you just push in.
Okay, so you're just stretching that glute like right here.
Right.
Okay.
It's hard to isolate just the piriformis, so it's basically a glute stretch, but
Okay.
the figure 4 stretch is one of the better ones to.
So then if I were going to do this myself, I would just grab it
You
like
can just
that.
pull back, yeah.
Awesome.
You can
Okay,
even
cool.
do knee to chest, so like a straight one like that,
Right
and
here.
it stretches glute and low back.
Cool.
You can do single or double knee to chest.
Yeah,
You can do
so like that.
Mm-hmm.
Awesome.
Yeah, so
That
those
would
are
be
two
helpful.
really good ones. And then another big thing with piriformis is a lot of manual techniques. So if it is truly bad, I'm a big advocate for conservative management like therapy or
Yeah.
chiropractic, whatever you prefer. In the clinic that I work at, I work with geriatrics, but they still have piriformis pain just like anyone would.
Oh, yeah, of course.
And so you can do what's called piriformis inhibition.
Uh-huh.
You're basically driving your elbow
Oh, wow.
into that piriformis. They're on their stomach, and you're passively rotating that foot in and out. So you're inhibiting that piriformis.
Oh, man, I had a massage therapist do that on me like
Yeah.
a couple weeks ago, and it's still sore.
Yeah, it's not pleasant by any means. You can scream like a little girl, but
Yeah.
after like 24 to 48 hours, you definitely feel a lot better.
Okay, cool. So then, yeah, is there any strengthening and stuff to do for that, or does preventing sciatic nerve stuff pretty much only have to do with stretching that piriformis?
I think a lot of it is stretching, strengthening wise. A lot of low back pain. So there's a big difference between, in a sense, a difference between sciatic versus low back pain.
Right, because sciatic nerve is like kind of more hip-ish.
Yeah, it can be more hip related. So, and strengthening of your hips and of your core
Okay.
can help with both sciatic pain as well as low back pain. So pretty much all low back pain stems from a weak core.
Yeah.
So you have to make sure that your core is not only strengthened but also engaged during all of your workouts. That's why, and ladies, I'm going to bring us to attention here because we're bad at this. Do not do any core workouts before your lift. Always do those at the end
Yeah.
because you're going to decrease the strength of your core, you're going to compromise your form, and it can cause all kinds of injuries.
That is a really great tip, actually.
So don't, if anybody tells you to do core work before a workout, they're wrong. Don't do it.
I'm like over here trying to think if I told anybody to do core work pre-legs.
You haven't told me. We're good.
I don't think I've given anybody core on a leg day ever, actually.
Yeah.
Well, because the legs is already core.
Yeah, we that one. No, but so that's the biggest thing. And then I get a lot of questions on, okay, well it hurts, so should I use heat or cold? And
Cold.
yeah, so it would be cold because with any type of inflammation, you want to use cold to what's called vasoconstrict, so it
Yeah.
reduces blood flow to the area to help with pain management and inflammation. Heat, when it comes to your low back, that's really your own preference and what kind of diagnosis you're battling. So if it's just general
Yeah.
low
So
back
heat
pain,
is really just more for like pain relief then.
yeah, a lot of
Or
times it's pain relief,
psychologically.
or you're trying to stretch a tight tissue that's just tight, not inflamed though.
Right, but because heat makes inflammation worse.
Right.
Okay.
It can, yeah. It can cause increase in histamine to affected tissues, which then causes more inflammation.
Now I'm going to go ahead and talk to us about impingement syndrome and then shoulder problems. So we have this band here.
Sweet.
So, Corey, I think impingement syndrome is the most commonly encountered shoulder issue in the gym. You know, you press too much, maybe you don't pull enough, stuff like that. And so is that like what causes it, or are there other factors involved?
It can also be just anatomical too. So
Yeah.
with shoulder impingement, you have your what's called your acromion process. It's like your collarbone, and your collarbone extends out right here, and there's a little bony point, and so there's a period where your scapula and that kind of connect.
So it's kind of like that. It feels like almost like a crack in the shoulder.
Almost, yeah, and it'll kind of feel like something's just like pulling, and it doesn't matter what you do, whether it's overhead or out to the side. Primarily, what's called forward flexion and overhead, you'll feel it the
It
most.
feels like getting stuck in a knife. I've had but
Yeah, it's painful and it can be common because that space is pretty narrow and
Yeah.
we have a tendon that runs through that narrow space.
Yeah,
And we can cause things that make that space more narrow, so like poor posture.
right,
So
like walking like
yeah, we
that.
talk about it all the time with my geriatric patients. It's forward head, rounded shoulders.
Yeah,
And so that really closes that space right there. So just having to retrain them posturally and bring their shoulders back to open up that space. And I see that a lot at the gym too. When you start lifting heavier, your form gets compromised.
yeah,
And that's a big no-no because especially with overhead lifting and then you start to compensate and your shoulders may round to gain
Yeah.
more momentum.
and you see guys lifting, kind of like that.
Yeah, you're constricting your pecs, your shoulder musculature, I mean everything. So
Well, and
it's
a lot of
pretty
people,
good.
they tend to neglect their back, so they get really pulled forward and everything.
Yeah, and that's obviously a way to prevent all of this is strengthening your back and specifically your scapulas, your
Yeah.
retractors.
So then what are 3 good exercises to kind of help prevent impingement syndrome from occurrence? Like what are three things that you would recommend people do? I mean, like let's say they're not lifters, maybe they sit at a desk all day. What are 3 exercises they can go home and do with just like some dumbbells or a band?
You can do rows, so you can do standing rows and just pull back.
So like if I were gonna hold a band and you held those handles, show me what those would look like.
So you're holding this and then
Yeah.
on standing, your feet, about shoulder width apart, a little bend in the knees,
Yep.
and then you're just rowing straight back.
Awesome, and then keeping the
then
scapula retracted
Yep.
and everything.
But you want to make sure you're not going like this.
Right,
Right.
because then you've got your
Yeah.
shoulders kind of
So you want to
retracted.
make sure you're standing with your back nice and neutral.
Yeah.
Your elbows coming straight to your side, shoulders back, squeezing your shoulder blades together. Nice 3 or 5 second hold, and then nice and slow.
Awesome, and then what's 2 more exercises?
2 more. So that's a great one for postural correction. The big tissue that's affected with shoulder impingement syndrome is called your supraspinatus.
Yeah,
It's a structure that runs under that gap that we were talking about, and it stabilizes the humeral head in that glenoid fossa of the shoulder.
okay, so that's like the cavity
Pretty
that
much,
holds
yeah.
your humeral head in.
Yeah, so you have, the ball of your humeral head and the socket of your glenoid fossa, and that supraspinatus wraps over that head to keep it stabilized.
So then I'm guessing it's like over time it just kind of gets aggravated.
Yeah, it gets aggravated up here,
Okay.
so that can reduce the stability of the shoulder and cause general pain and weakness.
And that could probably lead to even some tears.
Some
right?
tears, subluxation, all kinds of stuff. And then that's all part of your rotator cuff, so once one structure is affected, the chances of
always
other
are.
structures
Yeah.
getting affected increases too.
So then what can you do to strengthen that?
The supraspinatus is, we always do in the clinic your thumb up and you're
Yeah.
coming up like this. So you
Okay.
can do resisted bands with your force coming down and then working up against that force. You can use
So like almost like a dumbbell front raise.
Yeah, you can do dumbbell front
Okay.
raises.
See, because a long time ago, I switched from doing my front raises from like that to with my thumb up because I
Yeah.
noticed that I got a lot less impingement that way
Right.
versus doing my front raises the traditional way. I mean, it really made it hurt.
Yeah, even just the rotation of your hand can determine, how open that cavity is.
That's crazy.
And anatomically, everyone's different, so somebody may feel more spacing here versus here.
So then is that why, whenever you see somebody with shoulder issues, you want them to like press with a neutral grip versus out here?
Yeah, this, 9 times out of 10, this is going to be the position that allows that cavity to have the most space.
Okay, cool.
Very rarely is it like this, but no
Well,
one...
that's really informative though. I never heard that from anybody, so that was a good anatomical explanation. And then like one more strengthening exercise.
I always think side raises are great too, so that's a big focus on the medial delt.
Yeah.
However, just by that being strong, it's going to allow you to be able to bring those shoulders back better more so because of the form that you have to have during that exercise.
Yeah.
So just the way that your scapula should be positioned you should be standing with your back nice and straight and then coming up.
Right.
And so that's going to help you too, because you're working the medial delt,
But you have to hold correct posture.
right, but you're facilitating and stabilizing with, scapular and mechanics like that.
Yeah, just turn to the side really quick. So like, when she's doing her sideways, her scapula is retracted, not kind of over like that, where she could engage her trap. She's back right here. Awesome. And then just like a couple stretches that you would have somebody do.
Stretches, so...
Like by themselves, because like most people don't have somebody there with them.
Right.
There's good manual stretches, we all know that.
Yeah, I mean, if you have like a table, so
Yeah.
like if this was a regular table...
Hey, you can put some arms on the
Here.
table.
Okay. And then you come here,
Okay.
and then you're just leaning into it. Ooh, my shoulder.
So like you're kind of stretching your lat and then like your pec, like the bottom part of your pec there.
Right, so you can go like that.
Okay.
You can do just your hands behind your back.
Yeah, that's a great one
Like that.
for your front delt and everything.
Yeah.
So that's gonna open up that cavity.
Yeah, I mean, and I can feel it. So apparently.
Oh yeah, no, that gets me too.
Those are good ones too. And then of course, ice, NSAIDs if needed, and
Cool.
then rest. I mean, if it's inflamed, with all of these inflammation issues, you have to let the structures heal before you start.
Right, so
really
heal
rehabbing
and
it.
then try and treat them.
Yeah,
Right,
actually
so
let it heal. Give
if
it-
you're already hurting for pretty much everything we covered today, then take time off, whether it's a week, 2 weeks, 3 weeks. Stop your bench pressing, maybe like do flies or something like that. That doesn't put so much strain on your shoulder, and then try and fix it. All right.
Yep.
Awesome. Well, I appreciate